To David, congratulations. And he celebrated a birthday not too long ago, too, so congratulations on both. It's, you know, unfortunately, we had three new deaths over the weekend on Saturday, and my prayers and condolences go out to them families. This brings us up to 365 since this all started. Like I've said before, it's a difficult time. It's a difficult time to lose anybody, and especially early on in this when you couldn't have services and everyone has pushed them off to the future to say goodbye the right way. And still, unfortunately, there's still distance and everything else, and we need to do that to maintain everyone's safety. And still, people are deciding to do memorial services down the road, and it's tough. It's tough on anyone's family. So please, everyone, keep that in mind, in their thoughts and prayers to the 365 people. So as today, we had 21,333 cases of COVID-19 to date. We had 57 positive cases today, which is great. It's all the numbers going down. We kind of go up, we stick between there. We get down to the 30s between 100, which is good. That tells me everyone's doing the right thing. So our 5-day average is 52.4. Yesterday it was 53.2. We currently have 1,191 people under mandatory quarantine. Yesterday it was 1,283. 22 of the new positive cases today had close contact to a positive case for our healthcare workers. 31 don't have a clear source of infection. As of today, which this is another great number, 20,838 people have tested positive for the virus and have recovered. Out of that, 65 new recoveries since yesterday. 4 new people in the hospital overnight, 29 people currently hospitalized from the virus. Yesterday that number was 24. There are 4 patients currently in the ICU, and there was 4 people in the ICU the day before. We're all going in the right direction. We need to continue to wear our masks. We need to continue coughing our arm, clean our hands, and stay 6 feet apart. I know the CDC just put new guidelines out for schools. They're talking, instead of 6 feet, they're talking 3 feet apart. Had nothing officially, I believe, has not come out of the state. Cam, Mary, I don't believe anything came down from the state, but that came out over the weekend, which is good news. Dr. Fauci was saying get everyone back in school. They can be 3 feet apart. It's time. A lot of these kids have had major setbacks. My daughter hasn't been in school for a year now. A lot of schools, some come back part-time, some come back full-time, rotating schedules. It's really putting a lot of kids behind the curve to be successful moving on to college, and kids in college going on to the real world. So please keep that in mind. If you want to check your eligibility, it's 1-833-697-4829. Call 211 if you have any questions. I know there's still a lot of people having a hard time navigating. More and more people are helping people out. That's awesome. That people are helping people get appointments, navigate, and thank you to all that. You can still pre-register on our website at albanycounty.com, and you can see the different places that you can get COVID testing and everything else. Just go there. I've said it 1,000 times. One of the great things about our pre-registration tool, we've had over 34,000 people pre-register. Out of that, 11,800 come from the city of Albany. The rest are in Albany County. We've pretty much been exhausting that list, not just with a partnership with Washington Armory, but all the other providers around that have been utilizing it. And so I got to say, a lot of people have been happy. We had a nice pot at St. Sophia's on Sunday. I will say this, I know there was, it was a little tight quarters, more tight than I like it usually. We tried to do our best, had people wait outside in the car to wait for their time to come inside. But other than that, it went smoothly. Again, be patient with us. And I always say to people, if you don't feel safe, reschedule your appointment, and don't get that anxiety built up from sitting there. We tried to do it. Again, what happens is, and I'll say to people, when you get a time, pay attention to your time. Some people come late, some come too early, and some come real early, and you get that kind of that bottleneck effect where people aren't paying attention to their time slots. So, but everyone was awesome. They let people that were over 90 and walkers go ahead of them, so they didn't have to stand in line. So to everyone that said that was okay, thank you. To everyone that made that happen, especially my team in Mohawk Ambulance, thank you, and St. Sophia's for making it happen, and all the pods that are going on around the area. As of yesterday, we had 27.9% of Albany County population has received at least 1 dose. An estimate 14.2 have received both the first and second dose. which is great numbers. We're continuing to climb with, with Albany going on, Washington Armory, all the vaccine we're putting out there. Quicker we get to that 70%, we can quicker we get away from the mask, the quicker we kind of get back to some type of norm. And like I've said to everyone, the world changed when we were shut down. We had to reimagine everything, and when it comes back, and and try to get back into the real world, it's still going to be changed a little bit. So you have to be patient, and and don't let that anxiety build yourself up, and like I said, take a step back, take a deep breath, look around you. Remember, it's a marathon, not a sprint, and we'll get through it. So these are all good things. So the other thing, since January, Albany County has administered 10,577 first doses of the vaccine, 4,141 of the second doses. Overall, there's been over 20,806 doses of vaccine that has been put in people's arms. And as I said, every shot in someone's arms, a shot closer to getting back to some type of normalcy. Some of the good news, to everyone out there that's been waiting for the J&J, we just got notification as of today. We're getting 500 of the J&J, which is great. And we're going to primarily, in a partnership, get that out there with different things. We'll announce that. And trying to do more homebound people, because it's easier than to come back to a double shot. But I do say this, please. I know there's people who prefer different vaccines. If you get a slot and you get a time, take the one that's available to you. Don't trust me, trust the doctors. Dr. Fauci said the same thing. Don't wait for J&J. Don't wait for whatever dose you think is better. Take that shot if you can get in, because the quicker you get that in your arm, the quicker we get to being back open. So, again, please use our pre-registration tool to make that happen. And one of the things I highlighted on Friday, and we've been talking about this since the beginning of it, I always tell everyone, be blessed with what you have. As bad as you have it, unfortunately, someone has it worse than you. There's a lot of people that have been devastated from this, from the economy shutdown, from the health crisis, not having a job. There's been a lot of money pumped out into the economy. There's been a lot of great initiatives. Thank you, Senator Schumer and everyone else who worked on this. But again, which is alarming to me when I drive around, is the food pantries. And you see all the food pantries in the long lines. There have always been lines, but I don't think like this. And Natasha can talk about it. But it's so important right now that people, if you have the opportunity to donate food, please do it. You're getting an extra stimulus check. If you can give a little bit for food, volunteer your time. We'd appreciate it. There's 33 Albany County food pantries in this network, and I have to tell you, it will break your heart if you go out and you see these sites of what's going on. But Natasha, I'll let you talk about it, please.
Great. Thank you so much. So I'm with the Food Pantries for the Capital District. We're a network of more than 65 food pantries here in the Capital Region. And as County Executive McCoy said, there's more than 30 right here in Albany County. And I'd really like to thank County Executive McCoy and all of our friends at the county. We've had a really wonderful partnership this past year, and due to our partnership and support from the county, we've been able to coordinate the home delivery of enough food for approximately 3,000 meals since July to people who have been unable to leave their residence due to COVID-19. And that includes people who are under official quarantine and others who are considered vulnerable. So I want to thank you for that. We're continuing to do that, and that program is remaining strong in partnership with our member food pantries here. When we think about hunger, this is something that has always been prevalent and, of course, has been exacerbated drastically in the last year. Our stats for 2020, we know that there are more than 24,000 people in Albany County alone who sought assistance from our food pantry members last year. There's approximately 31,000 people considered food insecure in the county, so that still leaves a gap of about 7,000 people who are considered food insecure, meaning they don't have regular access to healthy food. And they're not utilizing food pantries, so that's why service coordination is so important. There are so many different programs out there working to get people food during this time period. And being able to coordinate that along with the county has been an incredible opportunity for us to build and strengthen those partnerships. One of the things that I wanted to mention is vaccines. We know there are some incredible vaccine efforts happening right now, and we want to thank the county for partnering with community-based organizations such as the Metropolitan Baptist Church with your vaccination pod. They are one of our food pantry members, and we're happy to be a resource with our coalition to help reach marginalized populations right here in Albany County. When we talk about hunger, again, this is not just an Albany County issue. Across the state, there's more than 1 in 10 households suffering with food insecurity, just like right here in our own region. It's about 4.5 million statewide. And there's more than 40% of our community members that are either living in poverty or they might be working, but they don't have enough resources to make ends meet. So when we talk about hunger and getting people food, I always need to mention that it is critical, number one, for all people who are working to have living wages. The second area that really fights hunger in a very large way is our federal nutrition support programs like SNAP and WIC and school lunch programs. So when we think about the solution, how do we do this, and we need to do it collaboratively, beyond living wages, number two, we need to have strong federal nutrition support programs. And New York State should really invest more than $1 billion a year to connect New Yorkers facing food insecurity with SNAP and WIC and other resources. But what we have most ability to impact is our community-based organizations. So what can we do right here in the Capital Region, right here in Albany County? So in order to make sure that our pantries continue to remain strong and open, number one, we're working on getting all of our food pantry workers vaccinated. As of March 1st, food pantry workers are now eligible for the vaccine. So we're working on encouraging pantry workers to get vaccinated so that pantries do not have to close due to exposure. Pantries in our coalition right now are really beyond capacity in some areas. While about 50% of the pantries saw increases over the past year, the other half are still maintaining, but all pantries are doing it understaffed due to volunteers. Many of the volunteers the pantries worked with are considered vulnerable or older adults, and also due to safety, pantries were limiting the number of people that could work in the pantry at any time. So volunteers, able-bodied volunteers, are definitely needed here in the Capital Region for typical pantry services as well as home delivery to our vulnerable and quarantined individuals right here in the county, as well as resources. I think most people, when they think of a food pantry, they go right to food drive, I need to donate food. But most of the food that pantries distribute through our system, actually pantries pay for. And so the dollars that you donate can actually go a lot farther for the food pantries when they're acquiring food from the food bank than if you were going to go to the grocery store and pay for food. So we always make sure food and funding are both needed here in our own region. So with that, thinking about what else can we do, continue to coordinate. One of the things that came out of the last year is a map for food distributions beyond pantry, because we know there have been a lot of mass distributions and drive-through food pantries. If you or someone you know is in need of food, you can go to our website, thefoodpantries.org, and click on Find Food Here. There's a map that will show you a listing, a map of the food pantries, and we also have a listing of other food distributions available as well. You can also call us at 518-458-1167 if you are in need of food for food assistance, or if you'd like to get involved right here on a local level to help feed the hungry right here. So thank you so much for having me here to give an update on hunger here in Albany County.
Thank you for everything that you do and all your organizations, and please donate if you can when you get that stimulus check in, even if it's just $1, even if it's just $2. It's going to go a long way to help families here in the Capital Region. because it is sad when you think of the numbers. I think he said 31,000 and then 7,000 people, which is, 7,000 people that don't eat healthy and don't have opportunity to get healthy food. And I actually learned something too when he just said about don't donate food, give us the dollar so we can buy it. Perfect, because that will help going forward. So again, thank you for your leadership in this, and please, people, take the time and do what you can. Go to our Albany County website, and again, to see about vaccines and other things, as always. And please, we still have hand sanitizer at our Times Union Center, so if it's available for people, if they still need it for their businesses or anyone else, 518-447-7040 or 7040 you can call to get that. And also our mental health support, please call that if you need to, 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. As always, the 211 and our sexual assault hotline number, 518-447-7716. Again, stay safe out there. Continue to do the right thing. The light's at the end of the tunnel. Good weather. Maybe is there a weather person? Good weather's around the corner, I hope, because it was a cold weekend. Hopefully it's going to warm up soon, and we can get outside and get some fresh air and back on them trails. Any questions?
Question is for Natasha. Obviously, we know at the beginning of the pandemic, there was a big focus on food insecurity, getting those food distributions up, food banks needing to get food out, and pantries. How have you seen that shift throughout, a year later now? Are you still seeing a demand as high, or has the demand lessened because maybe more people are getting back to work? Or maybe it's worse, what have you seen?
Sure. It's been all over throughout the past year. Some of the direct correlations are when the stimulus money goes out. So when the stimulus money goes out, typically people are feeling okay for a little while. Also, when we saw the pandemic EBT, so one of the good things that's happening is that SNAP benefits have been increased to maximum level right now, which helps families. So there are always people, though, that continue to need food pantry support. So I'd have to say that our base level of need has remained consistent throughout. And then what we've seen is jumps in the additional need. It was definitely the highest during the initial shutdown last year, especially when a lot of layoffs happened, people who had never had to turn to food pantries. Some people are back to work. We are expecting that this will impact our lower income community members for years as we wait for the jobs to return. So as long as the federal government can continue putting money out through stimulus and pandemic EBT, that does keep some of the pressure off the pantry system. But in our community in the Capital Region, on a regular year, there's 65,000 people who seek assistance from pantries in a typical year. So it's not a problem that has gone away or is going away, but it is something that through the pandemic we have been able to build some stronger partnerships. The state has come up with some programs to bring fresh New York agriculture directly to pantries. So there are some good things happening. So we just want to make sure that we continue to have a strong system to help everyone who continues to have the need for food pantry services.
And what about support from the community? In the beginning, again, we heard or we saw so many community members jump on board to help services like this. But then COVID fatigue sets in and support all over the place has kind of diminished. So did you feel that as well? Are you still, always trying to get that support, but has that kind of decreased?
I think that we've been very fortunate in that the community has really rallied around hunger and has been supported in supporting us in donations, which has been incredible. I think one of the challenges is utilizing volunteers. We don't have as many of those typical photo op, group team volunteer opportunities that we used to. What we really need is individuals who are willing to get trained to do a particular thing and can show up once a week or twice a week to fill specific roles. So for people who are interested in long-term relationships volunteering at a pantry as opposed to a one-time volunteer opportunity, definitely in need of those kinds of volunteers still.
Thank you. county executive. We heard reports of Larry Schwartz calling different county executives. I know you speak to him often, but did you get a call from him in regards to the report of him kind of trying to judge your loyalty for the governor? Has that something come across in your phone calls with him?
I wouldn't say judge my loyalty to the governor. I've had a lot of conversations. We agree to disagree on a lot of topics. I'd say we kind of argue back and forth more than anything else these last couple of months on a variety of issues. But, look, we go from one conversation to the next, to the next, to the next. And he's been doing a lot of good work trying to get the vaccine out to the state of New York. So you're never going to make everyone happy, right?
And has he asked you about the governor, or has that come up in conversations at all?
Briefly, asked where I stood, and I think I answered that question. Someone asked me that way before anyone else started coming out. There should be independent review. These women should be heard. Like I said before, as a dad with 2 daughters, they should be heard, and and there should be a full inquiry, independent, which I call for before anyone else did. That's outside the governor's control, outside the state's control, and the attorney general, who I have so much faith in. If you know her, you could be friends with her. She's still coming after you if you're doing something wrong, and believe me, that the fact that this independent firm has it, we're going to get the answers. Problem is, with any investigation that's fairly done, this could drag out for months.
And I was going to ask, and that might have answered it, what is your reaction to so many other public figures coming out calling for his resignation?
Listen, karma can be tricky, right? And, governor has called on a lot of people to step down for the same situation he's in. When this happened to Mayor Morris, I wouldn't call on him to step down. You're innocent to proven, guilty, and you should have your fair day regardless of the situation you're in. It's kind of hard when you didn't give other people that opportunity to ask for the same, standard, But I didn't say until then that mayor couldn't function no longer as mayor. When government gets so derailed, then it is time to step aside. And my interactions with the state right now has not brought me to that decision. If it gets to that point where I feel that the vaccine or my decisions with the governor's office or in general are being derailed because of the circumstances he's in, I will call for him to step down. I will leave this to the leader and to the speaker for them to decide, and they, that when they think it's a point that government can't go forward. There's a budget due April 1st, I believe, and they got a lot of work ahead of them. And unfortunately, government still needs to continue. We're still in a health crisis. We're in an economy crisis, even though we got this great bailout from Senator Schumer and Gillibrand and everyone else that worked on this bill. There's still a lot of people, food pantry, not to drag you into this, the food pantry, there's so many things that need help right now. Now's the time we need to work together in a partnership and not, careful how I say, not get sidetracked to what's going on. And if it continues to sidetrack us, yes, then he does need to step aside.
So I'm hearing a ton of complaints right now about nursing home visitation. It's not something that you're in control of, but it's something that you sort of have to enforce with Shaker Place because of the COVID positive. If you get one 14-day moratorium, has that affected Shaker Place? And if so, have people been able to visit their loved ones at all?
It's such a great question, and the problem is when the governor has press conferences and he puts out the information, people just hear you're wide open, and so do we. And then we got to wait for the guidance, and then we got to siphon through the guidance, and then we have to decide how you put it out. And one of the alarming things was exactly what you said. Yeah, you're open if you don't have a positive case. Well, you get a lot of that. Sometimes you got how many workers, how many residents at any nursing home in general in the state of New York that somebody is usually going to come back positive, and they could have already had the vaccine and just came up for whatever reason. So it is tough. And then when you read the guidance, it says 20% could come in the building at any time. And then if any new residents come to our facility, then the family can bring them in, settle them in. And thank goodness now that if anyone's passing away, the family could come in and say their final respects, and which is also good. Well, how do you explain to people that want to see their loved one, haven't seen them in a year? I'm sorry, I have 400 workers and one showed positive, so I'm shut down for another 14 days. We'll never open up, will we? I mean, it's going to be nearly impossible to open up. So I do not know that. We've been letting people in, so I have to check with my nursing home where they're at, but I have not run into that issue. But I know other nursing homes that I've talked to are the same predicament, because no one understood. They just heard open, and rightfully so. They just want to see their loved one, and now they're being told when they call or go to the nursing home, I'm sorry, can't come in, we're shut down for another 14 days.
I suppose this follow-up would really be best suited for Dr. Whalen, but I'll ask you anyway. What would be an appropriate bit of guidance as opposed to automatically 14 days blanket if there's a positive? Should it be maybe 7-day moratorium, or maybe based on the part of the facility? How would the guidance be adjusted to be more practical if you could do that?
Look, everything changes, and we've learned so much in these last 368 days, right, compared to what we learned to about 4. Schools were 6 feet, now they're 3. Now you can travel after April 1st if you have the vaccine. You don't have to quarantine now. It's the same thing in the situation. As long as you have masks on, as long as we're socially distancing and we're making sure, and trust me, our nursing home follows any worker. They treat everyone like they have it for this reason. Now we've learned a lot. From a year ago it was different. Now we safely, even if we have someone with COVID-19 in the nursing home, safely can bring loved ones in. The hardest part is, and I'll say this to the families, and I don't blame them, when they see them, we're like, try to limit the contact, and people just embrace and they start crying and they're hugging, and and the masks start, and they're like, I'll just say to the families, please, we can do it safely. I'm not a doctor, and I'd have to I agree with you. I'd have to say to Dr. Whalen, but we get our guidance from CDC. There's no reason why we can't have people in and do it safely, even if we do. As long as we don't have residents with COVID-19 and we don't have a huge outbreak, if it's under that certain threshold, which we've been under, we should be open.
And real quick, just to pivot back to state government for a moment, it seems at least possible now that the governor will be impeached at some point as the pressure is mounting by the state legislature. If that is the case, do you have confidence in Lieutenant Governor Kathy Hochul to take over the duties of that office?
Absolutely. She's a very strong individual, and been engaged for years, not just out in Erie County, but I have to tell you, I usually talk to her, if not 3 times a month, of what's going on. She checks in all the time, and there's no reason why she couldn't step up and do a great job as governor of the state of New York.
Speaking about government derailment and maybe not getting things done like you'd like, I know with all the allegations that are coming forward, the question still remains on a lot of people's minds, the handling of nursing homes. I know a lot of people are wondering whether or not that's going to be mired in will it be forgotten? Are you still looking for more answers, just like everyone else is at this point?
I can only tell you how I dealt with it from my nursing home standpoint. And I've said this before, I hope I make every right decision. I have to put my head on my pillow. I have to live with the decisions I make, right, wrong, or indifferent. The reason they made that decision in March to send patients back to a nursing home without infectious control procedures in these nursing homes, again, you're dealing with a pandemic at the time, and so much was thrown at them, and I knew how much was being thrown at us and how much we had to decipher every second of the day, every minute of the day, every hour of the day. And that's why I said, everyone, there's 64 spots on the chessboard, and you're playing all of them, and then some other spaces to make things happen. Whatever their decision was, it's better to come out and be transparent and say, look, based on that, we sent them there, made a mistake, and people died, and I apologize. I got to live with that the rest of my life. I agreed to take ownership of everyone at our nursing home because they're our family. They're not just a resident of Shaker Place. They're our family, and so are the workers up there. In every nursing home, and I think early on, I forget who in this room brought up multiple times in the beginning, we couldn't even get the numbers of deaths correct every week. The numbers are off. The infection rates are off. The State Department of Health, for whatever reason, couldn't get their act together with all the nursing home data coming in. So I don't know. That's a question above my. I always say this. The person behind me hates it. Above my pay grade, and it's a question they should answer. Why it happened? Based on a decision at that time, was that decision right? Probably. But is it? Should it have been corrected a little bit quicker? Yeah.
For those who don't know, I heard a rumor that your State of the County address airs this evening.
Yes, and I thought of you this whole weekend when I was doing it. Yes, it will be tonight at 6 o'clock on Facebook, and it is done. Thank you, and thank you to Andrew and to Mike. Putting all the hours in this weekend to get it done. It wasn't easy doing it virtual, and I did wait to the end. It's trying to find that time to commit to doing the speech and putting all the data together, and really there's so much we left out because so much has happened this last year, and the incredible workforce in Albany County. I couldn't have been prouder of all the departments because we focus on the health department, which they're doing, and Dr. Whalen doing an extraordinary, outstanding job. But there's so many other departments that keep us rolling, from the security, from maintenance to the janitors, you name it. Everyone has a function that keeps the services going forward, keeping the employees safe when they come in here, building maintenance. I could just go on, and it's just not here. Our water purification district. You could just go on and on and on. Everyone that's doing it. So I have to say thank you to everybody, and to Dunkin' Donuts for staying open so I could get my coffee. Back on coffee. Gave up caffeine for 10 years. Back to drinking coffee. Any other questions? Thank you, everyone. Stay safe out there.